Welcome. This is going to be a brief video on endometriosis and natural medicine, just serving as an introduction. Most everyone would already know that endometriosis is a disorder where the endometrium, the inner lining of the uterus, is found outside the uterus where it should not be. These grow into tumors, endometriomas. They continue to function influenced by hormones, etc., and thus there is related inflammation and pain. The most common symptom being excruciating pain or terrible pain. This is the cause for most people to seek treatment. One of the ways of being fairly certain that you're dealing with endometriosis is if the pain is life-altering. Life-altering pain with menses is far from normal, far from correct. Of course, the pain may be at any time, but more directly associated with hormonal changes, premenstrually, menses, less commonly post-menstrual, and quite commonly with ovulation. Okay, heavy bleeding. Menstrual bleeding is a very personal thing per se, meaning that it's quite different depending on the person. And it varies with physiology and pathology. It varies with body weight and body size and family history and circumstances, and really quite a variety of factors influence how much blood is going to have accumulated in the endometrium and therefore going to be shed. We have some basic ideas here. Quote unquote normal to use 1 to 2 average pads for a day. Of course, they make all these variety of super absorbent pads and so forth. Using such things in most cases, or at least very frequently, is going to imply that there's heavy bleeding, excessive bleeding. And, you know, going off signs and symptoms is a very good idea, because what is pathology but something interfering with your functionality? So you can simply ask yourself, does the bleeding make me, paler, weaker, lose strength, appetite, motivation, energy, etc.? Then this is too much bleeding. Infertility, a very common problem with endometriosis. So many women have been encouraged to ignore the pain, ignore the heavy bleeding, maybe just have been given the oral contraceptive pill or other means of hormonal contraception, like injection therapy and so forth. Many women have been encouraged to ignore the pain and bleeding up until the point where they're trying to get pregnant, and then the endometriosis kind of comes to the forefront. And I have the note here that very typically endo is present from, really we don't know when, but perhaps before birth. In other cases, it seems to occur much later in life. But we're not going to get into those details here. So endometriosis often found in ovaries, perhaps most common, but really the entire lining of the pelvic wall, pelvic floor is very common, intestines, fallopian tubes, of course. Endo is found in other places of the body. Why it's found in these places, like heart, lungs, brain, is very poorly understood or not understood at all, really. Yeah, so the only definitive diagnosis, surgical biopsy. if you find endometrial cells as part of an inflammation or as part of a growth somewhere else in the pelvic cavity, then that is 100% confirmed endometriosis. Okay, so biomedicine is reflecting on a wide variety of causes for endometriosis through the methods that they use and their perspectives. In Chinese medicine or natural medicine, the most common etiologies or causes being acute and chronic stress, physical trauma with or without added toxins, and inactivity. As I say, more complex than it sounds. A simple flow chart here. Experience, a stressful experience. We have a default, which is kind of fight or flight or tend to befriend, different hormonal stress responses, or an opportunity if our frontal lobe, prefrontal cortex can kind of take control. We can have a choice of what kind of emotion, what kind of result an experience has. Once the mind makes this choice, the emotions really follow that choice. The body tends to follow the emotions, the processes follow, and you can easily have endometriosis. This is not meant to be some sort of explicit biochemical explanation, of which there is none in existence at this time, but it's very, very clear that stress makes endometriosis much worse. Stress makes endo grow and increase and spread and so forth. So anyway, endometriosis east meets west. So this is one way of viewing it. It's the way that I have laid it out here anyway. Surgery offers a potential cure from the inside out, and which I'm calling working around the body. For physical medicine, physically removing the endometriomas and adhesions. And you'll hear some people say also removing inflammation. Chinese medicine offers a potential cure from the outside in, or working with the body, which we could call energetic medicine, changing the way the body governs itself. Changing the way the body governs itself. This is something that I can do very well for people with herbs. Sometimes, of course, also dietary changes, lifestyle changes. But changing the way the body governs itself is basically the way that endometriosis can be cured. So biomedicines come to believe and teach that endometriosis cannot be cured, even with surgery. So that perspective has to be taken with a grain of salt, because Western medicine essentially teaches that disease is not curable in general. You can look into that if you disagree. It's something you won't have difficulty confirming. The words cure and heal and so forth are not going to be found in most Western medicine, biomedicine texts. So in my 25 years of treating endo, I've seen approximately a 50% cure rate. So cure, no further signs or symptoms, no return of symptoms. In other words, do we need the endometriomas to entirely vanish? I don't think so. We just need them to stop being active and stop causing disease. So another 35% near total relief, mild fluctuations, another 15% or so, only some improvement, and the improvement fluctuating along with life circumstances. There's just no doubt whatsoever that life circumstances have a substantial impact on endometriosis, perhaps more than anything else. Most everyone has an idea of what acupuncture is, these days anyway. So we do use surgical stainless steel. We use only disposable needles. Acupuncture is very, very safe. Really, acupuncture and herbal medicine are very safe medicines, virtually never causing harm. Qi is a term we use a lot in Chinese medicine. Three basic translations here: energy, function, or dynamic action. Encyclopedia Britannica, energy in physics is the capacity for doing work. It may exist in potential, kinetic, thermal, electrical, chemical, nuclear, or other various forms. All of these, from potential, maybe nuclear, but probably not, but at least potential, kinetic, thermal, electrical, chemical, would all relate directly to qi and certainly other various forms. So qi then is a term for how, when, where, and why the body does work. I think when your purpose is curing disease and not just treating symptoms, then why is always the most important word. Why? Why the disease? Why the body is doing different things? Or why is the body doing different things? Chinese herbal medicine, it would be very difficult even in many hours to relay how very different Chinese herbal medicine is from Western medicine, but I have just a handful of points here to try to demonstrate the differences. Chinese herbal medicine involves 2,000 years of continually recorded development. Chinese herbal medicine primarily utilizes combinations. Combinations is how we get most things done, not by single substances. We can use formulas composed as early as 220 or around 200 AD, and as recently as today. Chinese medicine has always been inclusive, accepting whatever works, whatever is most functional. Chinese medicine continues to be developed and refined by experience and research, both clinical and laboratory. So the basis of Chinese medicine, right, is every day, every hour of these 2,000 years of history and experience. All the same, there is also clinical and laboratory research to aid in the understanding. So herbal medicine may provide a cure. These are some of the ways that we can do that. Circulate energy and blood to relieve pain. Relieving pain can almost always be done with herbs. No matter how severe the pain, we simply need to increase the strength of the medicine until there is no more pain. Invigorate blood to dissolve blood clots, thereby reducing pain, or there's at least a direct connection between blood clots and pain. Dissolve masses and reduce adhesions. This is something Western medicine does not do. So most people in Western medicine believe this cannot be done. So if I, Daniel Camburn, cannot dunk a basketball on a professional court, that means no one can do it. I'm simply saying that's the same logic. Western medicine cannot do this. I do it all the time. Western medicine also does not do this. Stop excessive bleeding. I do it all the time. Directly increase resistance to negative energy and stress. These are basically the same thing. Heal the effects of chronic mental emotional strain. Chronic stress or stress of the past basically accumulates in our body, does not really go away unless we make great efforts to get rid of it. Providing the energy and motivation necessary to heal. This is sort of like if you've ever noticed why some scars in your own body, you get a cut, some heal up right away very quickly, others seem to never heal. Or you get a certain bug bite, you get a little wound there, it heals up very quickly, another one does not heal for months or years. This is all related to the energy and the motivation of the body to heal. And with the right herbs, we can provide that energy and that motivation to the body. Chinese medicine is well proven to greatly increase fertility. There's a wide array of ways that we do that. In the old days, people believed that pregnancy could cure endometriosis. That is no longer the perspective, but certainly much of the time, a pregnancy, especially a full-term pregnancy, natural birth and all of that, will do a lot to reduce endometriosis. Creating a happy mind and healthy pelvis. Expert herbal medical care will typically provide relief for all aspects of endometriosis. creating what is essentially a cure. This has been my experience. Most of the time, for most cases, all that's going to be needed is herbal medicine, maybe some dietary and lifestyle changes. Herbal medicine can greatly assist you in preparation for laparoscopic surgery and with the recovery and, of course, the prevention of the return of endo after surgery. So recovery after surgery, prevention of the return of endo, these are things that we can do very, very well with herbal medicine. My experience here in New York, the best surgeons that I have found, Dr. Carly Goldstein and Dr. Tamer Sechkin, exceptional surgeons. So I recommend surgery only for bad cases of stage 3, stage 4 endo, where removing substantial amounts of tissue is likely going to be a very good idea. Okay, so creating a happy mind and healthy pelvis, directly face and address stressors, use of acupuncture, regular exercise, especially aerobic exercise, stretching, especially with controlled breathing. Stretching is something really underrated. So many people exercise regularly and really fail to do sufficient stretching. Controlled breathing is, the least expensive. It's absolutely free. You can take it anywhere. You can do it anywhere. It's highly effective. Diet, again, an underrated factor. So chemicals are such a ubiquitous part of American life. This is not a good thing. This is not a healthy thing. For example, much of the whole of Europe despises chemicals and views them as quite harmful to human health. In my experience, chemicals are often inflammatory, and inflammation is a direct factor in endometriosis. Chemicals can greatly weaken our immune system, and a weak immune system, autoimmune malfunction, these things all can go back to diet and chemicals and of course drug abuse, pharmaceutical abuse. So herbal medicine able to effectively cure endometriosis in most cases. I say most cases because most cases are simply stage 1 or stage 2. And most cases of stage 1 or stage 2 will be able to be cured with herbal medicine. Okay, trying to keep this nice and short. Distance consultations available globally. Please contact me with any questions. And thank you very much for your time and attention. I look forward to helping you get perfectly well.